Good afternoon. Welcome to our IAFC webinar series this Monday, April 29th, our weekly COVID-19 updates. We're pleased to have everybody here. I've got a couple of housekeeping slides to go through and then we'll get started. Before we begin, audio is being broadcast using the VoIP technology, voice over IP technology through your computer, speakers, or headset. Please make sure your speakers or headset are turned on and the volume is turned up. If you experience technical difficulties, please contact WebEx support at 1-866-229-3239 or at www.help.webex.com. My name is Dan Kerrigan. I'm a director on the Safety, Health, and Survival Section Board of Directors. Appreciate everybody joining in with us today and want to thank, first of all, ENVISAGE Technologies, our sponsor for this event, as we introduce our panelists and discuss training and documentation, your health during COVID-19. Next. Introduce Amy Morgan, Chief Clive Savacool, and Sean Anderson, who will be our panelists for today. I'm going to turn it over to them and let them introduce themselves in a little bit more detail, and we'll get underway. Thank you.
Thank you. I'll give a start here. My name is Amy Morgan, and I'm the Director of Academy Hour. I provide training on mental health topics for law enforcement and all first responders, either online or traveling the country, teaching at departments.
Hi, my name is Clive Savacool. I'm Fire Chief at South Lake Tahoe Fire Rescue. Prior to that, I worked for Garden Valley Fire District as a Fire Chief, and before that, I started my career in the San Francisco Bay Area for a large agency in Contra, Costa County. I started a program called Exposure Tracker for helping firefighters protect their health and safety, which now ENVISAGE is helping support, so I'm proud to be a presenter for them today as well.
And hello, this is Sean Anderson, a solution strategist with ENVISAGE Technologies. I've been with ENVISAGE for the past 5 years, helping public safety organizations and with a focus on fire departments, put systems in place to help them standardize their tracking, training, and their academies, operations. So that's where I also came out of the Navy after 7 years in the Navy and another 15 with DOD. So I have a long history with public service organizations. Slide.
All right, we can jump right into it. So starting off with our COVID-19 presentation, we'll start with tracking. So big background of mine and ENVISAGE through First Forward has developed a program that helps track exposures. And so with firefighters, we really thrive on standardization. It's why we have SOPs and SOGs. It's to help build structure within our organizations and give us direction on how we do our day-to-day activities. And so during this crisis, whatever means that might be, tracking what you've been exposed to and who you've been exposed to is critical. Next slide. So documenting the exposures helps build technology, or it helps incorporate technology. If you utilize some sort of medium that tracks all of the elements you're exposed to, then if you have to back up and check out different people you might have exposed to for tracing, it might help identify other exposures you've seen. One of the things you've noticed with the COVID-19 history is that as soon as the exposures first started popping up in our country, they started tracking down exactly who people were exposed to. So it's no different as firefighters. We want to analyze every single exposure we've gotten. Whether you're going to a homeless shelter and your patient tests positive, then you want to assume all the other patients there have the coronavirus until proven otherwise. And so documenting exposures is critical. Next slide. So, and then standardization. It's important for your agency to adopt some standardized form. And so that if some sort of crisis does occur, the agency is able to go back in a quick fashion to find out exactly what part of the exposures may have impacted the personnel. So if every station is doing it different, then it's going to be difficult to track it down. And that goes not just in line with the fire department, but keeping track with the police department. So the example I just gave of a homeless shelter, police officers might also have responded to that location aside from on a different call that you did or your personnel did. And so having good communication with standardized methods of tracking is going to help you also work well with your other stakeholders like law enforcement. Next slide.
So I'm going to talk about the mental health side of this about standardization in the culture and the tracking and documentation. The standardization of tracking also alleviates the question or the pressure about when to or not to track something that may end up later being significant. So if I were to ask a room full of firefighters after a significant incident, which ones of you think you may be affected by the incident in some way later, very few are going to raise your hand. But if standardization of that record was expected, it wouldn't be, do you think you may have been exposed as a question? Instead, it would be, you will be affected by this. Let's record the incident details so that you'll be able to refer back to them later when the effects start to present themselves rather than if. It removes that subjective viewpoint of whether someone may or may not choose to decide something is important enough to report it or not. All of it just is, and then it isn't left up to each individual. Next slide. Standardization of exposure tracking builds the structure and the order into what is already a chaotic situation. We don't need to add chaos by trying to figure out what to and not to document. Next slide. Standardization also creates an expectation, and those expectations can help reduce anxiety, which is also insecurity with individuals and within a department. So when we know what we're supposed to do, and we know what expectations are, it takes away a level of worry and uncertainty and fear. Next slide.
Yeah, and I'll just add to what Clive and Amy have talked about here with standardization, and talk about you bringing all this data together into systems, and you're collecting a lot of that data. And you may not know at the moment why you got that data, but down the road, it's going to be maybe of great significance as you start to analyze that data and look for trends. And then we're seeing lots of groups that have these systems and these standardization systems in place, where now with this COVID crisis, they can easily transition their training requirements either to an online platform, or they can shift the number of hours that they're teaching their curriculum quickly. So it's not such a heavy burden on the training staff, the training directors, to still get the proper training out. They've got a process, they've got it standardized, and having a good system in place helps you do that. Next slide, please.
Okay, so the culture of the fire department is based on us working well together. The culture is really what builds our history. And so, unfortunately, sometimes our culture hasn't been overly cautious. We've kind of been proud in the past of having our gear covered in soot, having our heavy leather helmets just blackened, and it's just kind of ingrained in us, and it's part of our tradition. So fortunately, because of how serious this event is, fire departments have been taking this pandemic pretty serious. Next slide. And so because of that culture, we really rely on each other. Our agencies, our fire departments were really built on teamwork and reliance of one another, because we spend essentially a third of our lives with each other. Next slide. And so one of the things that we've had to adjust in our culture is how we interact with each other. It was not uncommon when you come across another crew just to give them a handshake or even a hug, and that happens daily at different firehouses. And so one of the challenges we've had to adjust is our social distancing within our organizations and our culture. And it might not just be other fire departments, it's cops, it's the hospital staff. And so with our culture, it's important to make that abrupt adjustment on social distancing to ensure that we maintain those distances. And for me personally, I just started as a South Lake Tahoe Fire Chief, and so it's very awkward to not go in and shake everyone's hand. I'm meeting over at each fire station, so we have to adjust as firefighters. And it's one of those things where if we just do an abrupt adjustment, it makes it a little bit easier than if we try and just adjust over time. So it's important to really adopt that social distancing. Next slide. Okay, so then within this culture of teamwork, it's also important to still maintain those relationships with your brother and sister firefighters. And so even though we have that social distancing mandate that we have to adhere to in our stations, you might even have a policy where stations don't interact with each other unless it's an essential need to go pick up supplies or something. So despite those new barriers we have to work with, it's important to still maintain those relationships with your brother and sister firefighters so that you have that peer support. Next slide. So when we have these challenges we face, it's not just the stress. So every time we go on a call, we have that mental health impacts of the stress from that call. If it's traumatic, it's just a crisis where your blood's pumping, that weighs on you. It's a weight on your mental health. And so one of the challenges we're facing with the COVID crisis is it's not just we get back in the engine, maybe we stop at the coffee shop on the way back to sit down and debrief with your crew, but now you've got that overbearing stress of the actual event that's weighing on your shoulders as well, because now you've got to socially distance from your crew until you go back and decon thoroughly the station or whatever it is. And so this crisis we're going through is different than others on the mental health side and the pressures it's applying. Next slide.
So the culture of the firefighters or any responder is that of this predetermined reliance on your peers and your coworkers. So peer support in every possible way that now doesn't include the physical contact part of it is going to be more important than ever. The fears that you share among everyone should be, if not done previously, start doing it now. Discuss those freely so that no one feels isolated in what they're going through. It's common to feel like an emotional response is something that only that person is feeling or experiencing, particularly when your coworkers seem fine, they look fine, they're not outwardly showing that they're going through the same thing you are. Next slide, please. So often the thought we have is when we look at other people, everyone else seems to be handling this fine, but I'm not, so something must be wrong with me. But if you asked everyone else how they were doing, and you could get them to actually answer, you may find that they're going through the exact same struggle, but they're looking around and they're looking at you thinking you're doing just fine and thinking something's wrong with them. But getting things out in the open and just talking about it helps every situation. So let's say you are the only one that's feeling something though. How awesome would it be to have the support and the encouragement of your peers, of the people who do understand what you're going through? Next slide.
Okay, so the COVID-19 response for first responders, there is no silver bullet. There's no quick way to fix this. There's no secret as far as how we keep ourselves safe. It's really just adhering to the basic practices that were handed down from the CDC and other governing bodies that focus on the research with this crisis. It comes down to the basics on how we're going to address this as first responders. Next slide. So with those basic practices, we have to adhere to proper PPE, social distancing, quarantining first responders if they're exposed. So it's important if your organization, it's important for your organization to have a location. So we have basically some vacant Airbnbs in our city that personnel can go to if they're exposed, since we can have them tested and quarantined. So it's important to have those positions in place, but following the proper PPE, social distancing, and decontamination is critical. Like I said, there's no silver bullet. Example is the 9-year-old at my house. She comes in and she sings the happy birthday song as she washes her hands, because that was what she was taught on how long to wash her hands to get rid of all the germs. And so it's pretty entertaining to see a 9-year-old adhering to the policies that we're emphasizing at the fire department. Next slide. So the response we're going to be going through this for a while. It's going to be drawn out because there's no silver bullet, because of the incubation period of this virus. It's not something that's going to pop up and be exposed as soon as someone contracts it. And so this is going to be drawn out. We're going to have some time to deal with this. So it's important that over this long period of time, weeks, months, however long it is, we don't deviate. We don't get lax on how we decontaminate ourselves after calls. We have to keep all those PPE practices in place and adopt the new ones as they come down for us. And don't forget, sorry, one last thing on that slide is we, through First Forward with ENVISAGE, you can track the exposures to COVID-19. So it goes back to tracking. All of this needs to be maintained throughout the entire response for the next few months. Next slide.
Perfect. And to follow along with that, they're little things that you start letting go and you focus on maybe just the main things. It's important to keep all of the little standards and practices in place. Those procedures for managing or controlling a contagious virus are a lot like the procedures for managing or controlling a fire. You don't control the big part of it and let the little embers on the edges just kind of do their thing, thinking, well, they're small or they're separated, they won't do any harm. You know the harm and how quickly something small can spread into something bigger. So having precautions and standard practices in place gives everyone the security that an expectation provides, and it allows teams to know that everyone's going to be taking the exact same precautions, creating more safety, and it creates more security all the way around. Next slide. So anxiety, just to talk about anxiety a little bit. Anxiety comes from often a fear of something unknown. All of us have some level of fear or apprehension about things that have an element of the unknown. So the more we can learn and the more we can prepare, the less opportunity we have to end up managing something that's unknown. So preparing for things we think might not actually happen just provides more security. Less unknown, less being caught off guard and having to come up with a plan at the last minute in the middle of a crisis. Next slide.
Okay, so as I mentioned earlier, burnout is always a problem for firefighters, and it's instigated based off the calls we respond to. And now, as I mentioned, we have those pressures applied in all of our environments. It's not just on the call, it's when we get back to the station, and it's even at home. Some other issues come up with staffing. Next slide. So with the staffing, there may be times when we have exposures to our staff to where they need to be quarantined, they may be off work, or maybe their spouses are. We had to take a firefighter off work because his wife came down with the flu, and so we wanted to make sure that he wasn't coming into work to expose anybody. And so staffing issues can then increase other dynamics of burnout. If we have short staff, it means the existing staff has to stay on the job and work more hours, more exposure, more sleep deprivation, all those other elements that is just compounding the situation. So it's important to maintain plans to address these challenges. Next slide. So addressing these challenges really comes back to the leadership of the organization. The administration has to have plans in process, some sort of way to address these staffing issues and all the way up to worst case scenarios. And so the administration really has to be leaders, and they have to coordinate with other stakeholders, neighboring agencies in case they need to lean on one another. These are uncharted waters, and so leadership needs to have those worst case scenario plans ready to go if necessary. Next slide.
Oh,
I think you're muted, Sean.
thank you, Clive. Yeah, I was. And going right along with that theme you were just talking about, Clive, is that forecasting, being able to know where your people are at in your department across the different stations, what they're certified in, be able to move them around as you have different needs and as your staff has to take time off and be quarantined. So having that tool in place and having a good forecasting look at your whole department is key in these situations, as coming to light through a lot of departments right now, I think. Next slide.
Thank you, Sean. So to magnify the potentials for burnout, as I mentioned, we have those challenges on duty. We get the staffing issues. Now we get home. We get off work. We head home in the morning, getting off duty, and now we come home to a family that's been under house arrest. And so now you've got a whole nother dynamic of challenges, because prior to this pandemic, our families might have been our safety net. We come home, we leave work behind, and we're able to just go home and see the ones we love, get to spend time with them, get to go hiking or whatever it is. We had that source to go home to. Now when we go home, we go to people that might be cranky, that might be frustrated, might have lost that other source of income. The kids are off school. So now we've got a whole nother dynamic that's been thrown into the mix. Next slide. So with that challenge, when you come home, we might even have challenges where the family might have a level of resentment because they see us going to work, to the fire department, In their perspective, we're still going there, hanging out with their buddies, barbecuing, running calls, having exciting adventures, and now we come home to them and they've been cooped up, burning holes in the Netflix account, and just frustrated because they feel like you're getting to have fun and they're not. They could tell you the 9-year-old and 16-year-old in my house, they've been able to see any of their friends for what, 6-7 weeks. So that element, that stress we get compounded with when we hit home, has to be addressed. So we have to have some kind of source to relieve that pressure. Next slide. So to avoid that burnout with our family, we need to find creative measures to address the challenges that can compound the stress and make things harder for us at home. As well, you want to keep your family healthy and happy as well. I can tell you that at our house, we threw a surprise birthday party for my wife one day when we're all cooped up, and her birthday is not until August, but it was just something the 9-year-old and I came up with as a fun dynamic, and it played out. Another thing we did is I got the 9-year-old a Batman mask, and so when she did her morning Zoom call with her classmates, she had a Batman mask on, and it brought a little bit of happiness for that part of the day, and it was a way to kind of address that stagnant home arrest that they're under. And so make sure you have plans for your family as well, so that those dynamics aren't neglected, and it keeps your family still as that safety net for you on your mental health and for theirs. Next slide. Another big challenge is the suicide elements. With the stress of our job, there's already a higher level of suicide in our profession. So now you throw in these other stressors, and it's only going to compound it. And so it's important to really watch for warning signs with your staff, your family, and just so that those issues are addressed. Next slide.
To talk about that a little bit, the burnout for the mental health side, it starts out with the anxiety. You start with anxiety, which is it's normal. We're supposed to have anxiety. It's to manage threatening or intense situations, but it's supposed to be temporary and then subside, and you go back to your baseline. But when anxiety remains high, elevated, like in a responder career, you are always on the ready. You're always alert. You're always prepared. So anxiety isn't temporary and then subsiding. It just turns into ongoing anxiety, which is actually stress. Stress is also meant to be somewhat temporary, though longer lasting than just simple anxiety. When you have stress, it goes on, and you are just constantly staying in that elevated state. You don't get a reprieve from that, and you don't get a break from that. Like Clive was saying, you used to go home, and that would be your reprieve. And so, your heart rate would go down and all of these things that are good for your health. Now they're just staying elevated, and you're not getting that break. You're not allowing your body and your mind to have some calmness, and that's where stress can lead to burnout. And burnout is really difficult to reverse. It takes a lot of undoing, of not just like going on a vacation. It's a long process to undo burnout and to actually get out of the state of burnout. Next slide, please. So having a balance, it sounds kind of fluffy maybe, but it's really important between that stress and calmness. And this can help prolong your career, and it can prolong your health, and just make your life better in general. So to do this, integrate as many positive things into your life, the things that do calm your heart rate and rest and bring you down to a non-anxiety, non-stress level. And that's to counterbalance those negatives and the stress that you're seeing now, that you're always seeing. So if you're constantly focusing on negatives, or you're being exposed to negatives, you're hearing the news about COVID all day long, you're hearing about fatalities, and you're also taking in all your usual negative that comes from your career and your job, then that negative starts to take over. So you've got to not just create a balance, because you don't want equal parts negative and positive. That's a balance. You've got to counterbalance all that negative by adding in just as much positive as you can every day. You just want to saturate with the positive. Next slide, please. So I want to talk about the positive, or what people tend to do, which are coping mechanisms. A lot of people just cope with all that negative, not by counterbalancing it with positive, but with things that kind of numb or distract or divert your thoughts and so forth. Negative coping mechanisms are things like drinking, a lot of day drinking, spending money, gambling, infidelity. All of these are very common diversions in a firefighter career. These happen because the positive or the healthy coping mechanisms that would be the most beneficial don't seem acceptable or haven't seemed acceptable, in things like counseling and spirituality and peer support, talking about what you've been through. Alcohol is just an easier thing. It just is right there. It's quick. You can just numb it. You can be by yourself and do your thing. But alcohol is a depressant. So when you take an already negative situation and you add a depressant into that, it just makes it more negative. Alcohol can create all sorts of long-lasting problems, we all know. While in the moment it does seem to numb that pain, it really only makes things worse over the long haul. Next slide, please. So I put on here some numbers. Like Clive said, suicide is high in firefighters and all first responder careers. And a lot of that is because of all the trauma that's seen. And I'm going to talk about trauma in a minute, but because of this constant barrage of negativity that you guys get through, these difficult incidents before COVID, everything that you were already going through is hard on you. The things that you see, we're not designed to see as human beings, and you see them regularly. So it's hard. So you got to watch for signs in yourself, watch for signs in your coworkers, things that look like depression, anger, irritability, any signs of excessive stress you want to watch for. I put some resources up here. I'm going to hope that we can make those available later as well, but screenshot this or take a picture of it with your phone or whatever for yourself, but also for someone else, one of your coworkers. If you think maybe they might need help and they aren't going to make the call, maybe you can sit with them and make the call with them, because sometimes when someone gets to that point, someone has to help them through that process. So I put these up here. The one at the bottom is for public safety personnel only, unlike the one above it, National Suicide Prevention Lifeline is for anybody. So that's spouse and kids, anybody. And then the link for the Share the Load program and the Fire EMS helpline. So be sure and make notes of those resources and use them for someone else, if not for yourself. Next slide, please.
Thank you, Amy. And just a quick note on your last slide. For those fire officers out there and administrators, you understand how hard it is at times for firefighters to come forward when they have mental health challenges. And typically, when it does present itself, it's in a negative situation because it's snowballed too much. So if you can provide that information that Amy just put up to your staff without being prompted, just say, here it is, and send it out in an email or interdepartmental email or something, just so they have it, that can help prompt them, because then they can feel the anonymity of contacting one of these helplines without having to come to an officer and feel embarrassed. So please send that out to your staff. Okay, so readiness and preparedness, it's important to have a plan in place. Similar to what Amy just talked about with the suicide prevention, you have a plan in place so that your staff has direction. Next slide. Okay, so take a couple seconds and think about what happens if we don't have a plan in place at a structure fire. So we arrive on scene, we've got 4 other units showing up, and you're the IC. If we don't have a plan in place, what's going to happen? They're going to freelance. And so it's no different with this situation. If as fire officers, as chief officers, if we don't have a plan to give our line personnel during this crisis, they're going to come up with their own plan. So it's important for us to have that preparedness, have that guidance for our staff. Next slide. So with that plan, it's important that it's consistent, not just within your organization, but consistent with neighboring organizations. Coordinate this with your EOC, with neighboring stakeholders, law enforcement, just so that everybody's on the same page. We have a policy in place at my department where if the ambulance company has a transport of a COVID patient, we decon the ambulance for them. And so we have these readiness and preparedness plans in place so that field personnel have a clear understanding of their roles and responsibilities. Next slide.
Thanks, Clive. I think going right along with that message about having lots of plans in place, there's going to be a lot of new plans in place after this crisis as we come out of this. On the other side, there's going to be lots of lesson learned, a lot of training updates, lots of new certifications possibly, and compliance issues. So having a system in place that's going to help a department, an organization, track all those certifications and quickly deliver that training in a standardized method is going to be very important. And it's also going to maintain accountability standards for the personnel, facilities, and your inventory. The PPE inventory is becoming so critical now. And so a lot of that stuff carries expiration. So if you've got a system in place that helps you know when things are expiring and you can plan to replenish those assets, that's going to be so crucial as we prepare, for the next wave, or hopefully this never, God, we don't want this to ever happen again. So, but we got to have a plan, as you said. So, next slide, please. And that talks a little bit about that compliance piece here of just having that certification criteria, having all your personnel and inventory certified, be able to quickly track it, pull up reports quickly, get to that information. The leadership is comfortable that they know who is certified, their equipment is certified, and they don't have to stay up at night wondering where things are at and how much they have of it. And another thing, a nice tool like Cadus can help you with is automation. And so sending out email notifications when things are either to people or to groups of people about equipment that's certifications are expiring. That takes a lot of worry and a lot of load off the staff, so they can do more important things. Next slide, please. And then overall, just having a total personal training life cycle from the time you hire somebody and bring them in at the academy as a recruit, all through their probationary period, up to they're fully on duty. You're tracking everything they're doing. You've got a nice historical record of their training path. You can set up career goals for them and have that all listed out. And so it's very transparent to the leadership in the department and also to the fire department on that path to grow as a firefighter. Next slide, please.
Thank you, Sean. And a quick note on those comments. You said a lot's going to be learned from this crisis, and I heard a great quote the other day that crisis exposes weaknesses. And so throughout this pandemic, we're going to see the faults in our practices and procedures. And so throughout this, it's great to track all of that information so that we're more prepared next time. And so thank you for bringing that up. So back to the readiness and preparedness, going in line with having that plan. If the administration doesn't have a plan in place for the troops in the trenches, then they're going to look for sources themselves, and they're going to fill in information. They're going to fill in any voids of information with sort of pessimism. And so it's important to keep that line of communication open as well. We have Monday, Wednesday, Friday meetings throughout our entire county on our COVID crisis, even when there aren't any updates, just so that we can disseminate that information to the line personnel so they feel like they're included in the most recent up-to-date information. Next slide. So with that note of our meetings we have Monday, Wednesday, Fridays, it's fortunately there's a wealth of information out there. Every state, counties, cities, everybody has been coordinating through hopefully an emergency operations center, an EOC, to disseminate that information. So make sure that your organization is involved, getting information and providing information. If you had an outbreak, if there's some sort of issue you found with a practice, make sure it's reported to that EOC so that everybody else in the community also has that information and vice versa. It's what's really going to help us get through this. Next slide. So with this readiness and preparedness, once you come out with the new policy or once you come out with the practice that's going to help protect your personnel, you need to have it as an abrupt change. Make sure your battalion chiefs are out there with your officers enforcing, making sure that everybody's following this and taking it serious. If management hands down a policy, just say there's a new practice to protect our staff, and we just send it out on an email, but don't really give much follow-up on it, line personnel they're not going to think it's very important. So the perception is going to be that if it's not important to management, it's not important for us to follow it. So make sure that your officers are out there supporting the personnel, emphasizing how important it is that we follow these practices that we're adopting. Next slide. So in line with that, we had that old saying of those who fail to recognize history are doomed to repeat it. One of the things that I've done during this pandemic is just done a lot of research with the 1918 pandemic, because I was just curious on how that was handled, what happened during those occurrences. And one of the elements that came out of that was the two polar opposite ways that Philadelphia and San Francisco addressed that pandemic. And so if you look at that one, Philadelphia, they really didn't adopt the social distancing, keeping everyone somewhat away from one another. In fact, they had this huge parade to raise money for war bonds. San Francisco broke itself up into grids, the health officers broke on the grids. They made sure that people they enforced it, made sure people wore masks. They actually cordoned off the Navy Yard because that's how the pandemic was getting into communities. And so San Francisco had a very low impact during the second wave of the 1918 pandemic, whereas Philadelphia, shortly after their big parade they had and avoiding the social distancing, they had mass casualties. And so you look back in history on how different, you call them sample populations, addressed that pandemic. It really exposed what the best practices were. And so looking at history, we can really identify that, yes, social distancing, proper PPE is the only way to beat this. Next slide. So with this pandemic, we can learn from this and take every precaution possible through the preparedness. So as I mentioned, with the policies, enforcing them, looking at history, all of that comes together is what's really going to make our staff feel like they're prepared and supported. Next slide.
Good. So just like we know what all the signs and symptoms to watch for, like here's what COVID-19 does to you. Here's what you're going to watch for. If you see these signs, this is what you should do, or this means you may have it, or you may have been affected by it. We want to do the same thing with your mental health. You wouldn't say to someone, here's the signs, but you're going to be fine. So knowing ahead of time what all the aspects of this may do to your mental health will help you prepare for that. Will also help you know that there are solutions for it, and that the reactions and the responses that come from it are normal. This alleviates someone's fear that they're going crazy or something's wrong with them. When a critical incident occurs, trauma can be a result, any critical incident, and that's normal. Trauma from that is normal because those are abnormal incidents. At all the lists of potential mental, physical, and emotional responses that come from trauma, which I'll show here in a minute, if a department is told that what we're going through is going to be difficult, but you're going to be okay, then everyone's expectation is that they should be fine, they should be okay. And anything other than that, something's wrong with them. They're not supposed to experience any negative consequences from that. But if it's explained properly and accurately that this is difficult, but this also could create trauma, and here's what trauma does to you, then when it happens, they'll know they're just having the normal and expected responses to what they're going through. So being prepared ahead of time with when you experience this, here's what you'll see, and here's a solution, or here are resources you can use, is going to benefit everyone more. They'll know how to handle it when it happens rather than ignoring it and doing nothing for it. Next slide. You may not think on the job you're experiencing a trauma. You may just say, well, I've seen some stuff, but I don't know that I would consider it trauma because, it's just part of the job or whatever. This is the criteria for the types of events or incidents that qualify as trauma. If you fear for your life or safety, you think about COVID-19 right now, everyone is basically fearing for their safety and sometimes for your life as well. Watched or heard about this type of incident, you had a close relationship with someone involved in this type of incident. If an incident has an element that is shocking or unexpected, so think about all the things you see on the job every day. If it goes against social expectations, and these are things like murder, rape, torture, all of the things that you see. In any situation that doesn't fit into those, any situation faced that causes a distressing, dramatic, or profound change or disruption in your physical or psychological function. Basically, if it affects how you're functioning great, everything's going great, you're able to do all the things you can do in life, and then all of a sudden it's affecting you physically or psychologically, and your ability to function is somehow impaired, that's the result of trauma. Next slide, please. So these are the normal, some people don't like the word normal, but these are the normal expected responses after you've experienced a trauma. So when you start experiencing these, not if, seek counseling, talk to someone, use your peer support resources. These are the things, just like when we say, hey, you've been around someone who's exposed to COVID or who has COVID or is tested positive or whatever, you're going to watch for cough and difficult breathing and all of these, that list of signs that you're going to watch for. And then when you see those, you're going to get help, or you're going to go, whatever you're going to do. Quarantine. These are the same things. It's just your mental health rather than your physical health, but this can also affect your physical health. So trauma affects your mental health in these ways. And I'm talking while I'm leaving this list on the screen because I want you to read through it and see and be like, oh, I have that. Oh, I have that. I have that. If you're seeing these signs, that's because on the job you've experienced trauma, and the COVID-19 pandemic is creating that same trauma type of incident. So looking for these things, these are the expected outcomes, expected responses of going through a trauma. So these make you normal. These make you like, oh, this is what's supposed to happen after that. I should go get help because I'm seeing some of these signs. Also, watch for them in other people. So someone may not tell you that they're having an effect or that they're being affected by this, but if you can see some of these things or signs of these things, then get someone else help. So look out for each other. Try to ask for help if that's hard for you. I get that. Nobody wants to say, man, I'm struggling. I really could use some help. But that's how we get better. If you thought you had COVID, you wouldn't be like, man, I can't breathe and I'm coughing and I feel feverish. I'm just going to not tell anybody. You go get help for it because you want to stay well. Same thing here. It's no different. You've got to take care of yourself and you've got to take care of each other and you've got to look out for each other. And peer support, great. Counseling, great. Do all the things you can do to help heal and restore back to your original healthy self or better. Next slide. I think we're on to questions and answers, possibly. We have.
Hi, this is Dan. I have something for you to get started, and this could be for any of the panelists. I know that we're all hyper-focused on COVID-19 at this point, and rightly so. But regardless of what the exposure is, can anybody or all of you, any of you, speak to the importance of exposure tracking and documenting these exposures in the longer term? You know, how important that is for individual firefighters, emergency responders, to, I guess, for lack of a better term, create a sort of diary of exposures that's able to be tracked over the longer term. How important is that for us?
Sure, I'll take that one. One of the dynamics of tracking our exposures on the job is, and this is really one that goes hand in hand with technology, is sometimes we don't know what the values are down the road. And some things that we're collecting, we might not realize, but that actually is going to have a big impact down the road. And for an example, tracking and I'm just speaking in generalities with exposure tracking, we historically have just tracked, say, fires. You know, we went to a structure fire, we documented how many SCBA bottles we went through, who we were with, and that sort of information. But over time, the long game, as you mentioned, is the cumulative information. And so when we track all these incidents we go to, every call, medical emergencies, lift assists, getting cats out of trees, whatever it is, that all builds up. And then you throw in sleep deprivation, you throw in stressors of just consecutive work hours where you don't get a lot of time off. And so that data that we're collecting through exposure tracking of every type of an incident is really down the road going to show other stress dynamics. And so if you have that term sample population they use in statistics, when you have a big enough pool of sample population data, you can identify potentially contributing factors to our profession. You could say, hey, if you go on more than 2 emergency responses every night, then it's going to increase your chances of cancer, this X percent. And so tracking exposures is critical, and the more information you put in there, the better it's going to be. And for example, the first forward, it ties in with dispatch, and so it'll automatically populate with some of the calls you respond to. And so whatever medium you use to track exposures, it's important to track as much information you can, which can also then provide that source to go back and research if there was a significant call. I'll give you an example. There was a rail yard fire that was actually before my time in my old department, and I think every single firefighter there came down with pancreatic cancer and passed away. And so there's certain types of incidents that we want to monitor and make sure that we track as much information as we can.
Good stuff. I can't disagree with you. I feel like definitely that, even when it comes to presumption and the like, anything that we can do, whether it's tracking exposures, whether it's making sure we're getting our annual, physicals, behavioral health checkups, and all those things that go to, our own health and wellness and well-being that are going to benefit us if unfortunately, let's be realistic about this, unfortunately, some of us, we're going to come down with something at some point, or, we need to be able to kind of draw that line or connect those dots if and when we have to fight for our own benefits and so forth as well. So there's definitely, we don't always know the specific reasons why we're doing these things, but that doesn't mean we shouldn't be doing them. So that's good stuff. So we have a question here. How do I share this with my boss, who I believe has or has a lot of these signs of stress that were talked about today?
How to share the webinar?
So
or how to
in other words, if I'm observing somebody above my pay grade that is exhibiting these signs and may not have the courage to acknowledge that, how can I go up the ladder and share information with somebody above me?
Well, I'm not in that firehouse hierarchy, but I can talk to mental health, and then Clive maybe can address that side. So as far as if you're concerned about anyone's mental health and you can see signs that they're struggling, that hierarchy may make you think, I don't want to go up and accuse someone of struggling that's over me. But also you have to think about them as people. And you may make someone mad. You may distance a friend, outside the house or whatever, but by saying, hey, I'm concerned about you. But it doesn't matter your position as much. Of course, like I said, I'm not in that class. I want you to speak to this, but I think if someone, as a human being, has someone else come to them and say, you look like you're struggling, I'm concerned about you, and I want to help you, how can I support you? If you just say, how can I support you? How can I help you get through this? What can we do to help support you? Then it's not saying, hey, you look like you're really about to falter, and we're all worried about that. Like, it's a little bit different. So if you can say it in a way that we're here for you, and we're kind of looking, and you're kind of showing some of the signs, that we all have, but we want to support you. I think offering support for someone doesn't take you out of your role. And just as a human being, we all want someone who's going to offer to support us. I will let you take the other part of it.
Okay, yeah, that's a very, very good question. And regardless of it's your supervisor or whoever in the agency, I can tell you that it's really hard to identify the signs sometimes. As firefighters, when I look back at the people that I've seen that the mental health consumed them and ended badly, it was, if I look at the people that had it, there was no sudden change in behavior. So because it was gradual behavioral changes, it's like, oh, that's just so-and-so, they've got a bad attitude. And so if you put them side by side with everybody else, it's hard to pick them out as far as them having different symptoms. And I can tell you that when people came to me with when it had snowballed, it was too late. I mean, not too late, but they should have come way earlier, and they just fell apart. So it's really important as officers to really take a look at the people around you and keep an eye on them, and not just think about how they were the previous shift, but think about them a year prior and think about these behavioral changes. And to be honest, almost every scenario I can think of with guys that had issues, substance abuse was a factor as well. So there's some warning signs that you really have to key in on. It's not always going to be apparent. And then as far as the issue with it being a supervisor, it really is just getting them private. And kind of another dynamic with firefighters is we hate awkward situations where you say, hey, man, are you okay? And you kind of drag it out. That just makes it more awkward. The best luck I've had is like just going up and saying, hey, man, what's up? Are you all right? And just being very direct. Firefighters love direct. And so even supervisor, get them in private. I had a captain years ago that had a loss outside the fire department, and I just reared a fire, and he just had a horrible attitude. Everything was awful, and rightfully so. He just lost his son. So I said, "Hey, man, are you okay?" And at first he was kind of perplexed because he didn't realize how stressed out he was, and then he kind of settled down and did some self-evaluation. But what I would say, if it's a supervisor, just find him in private and just be straight up with him and say, "Hey, man, are you all right?" And it's much better than some awkward, drawn-out sort of conversation.
I just want to add one more thing to that. That was awesome.
Sure.
And the fact that, you're looking for signs, like you said, it is gradual, but watching someone you may not notice, we all hide things, right? If people are really struggling, they're doing their very best to hide it. So it's not like you can necessarily see an outward presentation of someone's struggle, but if you know they're going through something, or you've all been through something and this person has certain coping mechanisms or whatever, just because you know the people that you're working with, just know them as people and know that they've gone through something, and then be like, okay, you usually do this and you're going through something. You may not have seen any signs at all. Check in anyway, because everybody hides things really well when they're struggling.
Okay, next question. Have any of you noticed an uptick in use of EAP and or peer support? If so, do you have a breakdown as to if it was with members or members' families?
I'll just speak to the EAP side and say that I don't have that information. It's kept anonymous on purpose, so I couldn't tell you how many more people have contacted EAP. I can tell you that family members seem to be more engaged. Fortunately, one benefit of social media, there's a lot of downsides, but one benefit is it seems like there's been more interaction with firefighters' spouses on social media, just being engaged and to be honest, kind of just posting their thoughts and feelings. I'm not a big social media user, but when I go on, it does seem like that outlet has been increased, and so there's been more engagement through those sources with family members of firefighters. But as far as the EAP side, I'm not privy to that information, so I couldn't answer that.
Since you brought up, I'll just chime in here real quick, and since you brought up social media, what are some strategies do we have to fight that as well as everything else we're dealing with right now in the emergency services, or are we finding that our members are paying attention to less than reliable sources for their information, or how do we manage that?
I'll answer that one first. The source of information that is important for us to get that to our staff, make sure they're up to speed on what's going on within our county. So no matter what information they get from social media, you want to have more information heading their way. And so I don't know how much negative input is being brought and put into people's brains through social media. To be honest, when the few occasions I'll go on, it seems like people are trying to be positive. The fire department, we're trying to use social media in a very positive light. The firefighters did a parade for a little girl's birthday party in our community. And so they took all the fire engines and they drove by the house to wish her a happy birthday, because she obviously couldn't go out and see her friends. And so she got a parade from the fire department. And so we put that up on Facebook. And so it really got the community some good news for the day. And so you really can and should use social media to your advantage. I know sometimes it pulls people out of the weeds to make negative comments, but if you do something positive like that, it's hard for really people take shots at you. So I would say use it to your advantage the best you can, and if you disseminate the information as often as you can to your staff, that will help supersede any negative information they're getting from social media.
Okay. So in terms of tracking, we talk a lot about obviously exposure tracking in this webinar. Should firefighters also be tracking their fitness routines as well? We know we should. Hopefully, most of us understand that regular fitness is not only important for our work in general, but also is a great way to relieve stress and deal with the anxiety and the stuff that we're dealing with right now. But should we be tracking our fitness routines as well, and who protects the data in that system? Or maybe you can speak to just the security of the the data that gets input into these trackers.
Sean, would you be the best to answer that one as far as the tracking with the CADIS or First Forward?
Yeah, I can handle some of that. I think you've got a good handle on that too, Clive. A lot of that data, you talk, especially on the security side. So we make sure that the systems our systems are very secure and up to all the federal standards to make sure that PII information is safe. Doesn't include any kind of HIPAA kind of violations and when I get into health information. So we're very careful with that and very conscious of that. And that security is built into our technology from the ground up. And that's all we think about every day within our organization about the data security and the security of those and the access to the information.
And then I'll just speak to the exercising part. It's very important to keep that some form of your routines up. I couldn't be more proud of the firefighters I work with, where you ask any of them what their priorities are, and they'll say run calls, exercise, and train. And so every day they're getting into the gym between 9 and 11. 9 and 11. Obviously they'll decontaminate it the best they can when they're done. Another fire department, neighboring agency, I know guys come in off duty also to use it, the gym at the station, because the ones out in the community are closed, and then just doing proper decontamination of equipment afterwards. But being that we go home and we're under house arrest at times, it's hard to get out and keep that physical fitness level up. So that can fall back on the company officers, making sure that their crews are adhering to those practices. But exercise is very important because it not just helps keep you in shape, but it helps with the mental health side. I'm sure everyone can look back and think about after they go for a nice long run, they feel better the rest of the day. And so exercise is important for both physically and mentally.
Okay, let's see here. We still have some more questions. We'll see how much time we have left. So I make sure that we cover this. Can you please just let us all know how we can get more information about the exposure tracking programs and how we would register for those things or download them or whatever the process is?
Sean, you want to spearhead that one?
Yeah, I can. The URL for First Forward is very simple, firstforward.com. It's all one word. And so anyone can go on there, and it takes you just a few minutes to set up and get your account established. Just takes an email and your name. And so you'll be in the system, and you can contact there's information for our help desk. If it's pretty self-explanatory just to navigate through the system and start setting up your account and tracking your exposures. So firstforward.com is the URL.
Okay, thank you. And once again, thank you to our sponsor, ENVISAGE, for helping us out with the webinar as well. So let me look here. I'm looking at these questions. How should firefighters and departments support home health and safety of the personnel that they have working for them? How involved should we be in that? In other words, carrying that process home. How can we help continue that process off duty?
Amy, you want to take that, or you me too?
I can do the mental health side of it if you want to take the PPE and that sort of thing. As far as the mental health, taking that home, you want to do things that take you away from thinking about the pandemic. They're trapped all day, trapped in their homes all day. I mean, you can't leave. We can't go do things. And so the mental health side is going to be really tough. Then you're coming in and out. They've got the concern for you, for your safety. They've got the concern that whatever you may be being exposed to and then coming back into the home with. But anything you can do, again, that's back to that counterbalance. Don't just kill time. Actually do things together that are positive. Integrate all those positive things. Alleviate all the stress that you can from their concerns. Maybe don't talk about the pandemic, the whole time. Or what you did all day. I mean, you can go home and it's good to unpack what happened during your day because that keeps that unknown from bothering them. Be as open, as honest as you can based on, what the situation is at your home, but then do things together that take you out of thinking that, learn things together, get everybody in the home doing something together that helps you grow together. Anytime you learn something with somebody, it helps you grow as a group, as a family, as a team, whatever it is, a partnership. It helps you grow. So do something that just takes your mind off of it, not just killing time, not just sitting around watching TV and that sort of thing, but actually like investing in energy that takes you away from thinking about all of the negative. I'm gonna let you, Clive, address the how you guys are handling your processes and maybe take that same process home.
So if I'm understanding the question right, it's how to protect the family and so on from the exposures and the PPE side of things, if I heard that right.
I think so.
So that continue the practices after every call, proper hand washing, all that. At our fire department, we take our temperatures at 8 a.m. and 8 p.m. to make sure no one's getting a fever. We log any symptoms. When we come on duty, we check our temperature. So it's important to keep those practices up. When we go home, it's important to have those separation of your uniforms and anything that might have been exposed to make sure that you yourself are decontaminated in that before you go into your house. I can tell you one firefighter whose spouse is also in the medical profession. They have a decontamination setup in their garage, and so they go in there, and so basically they go into the house in their underwear because they get all their clothes off and they go in just to keep it a sterile environment. So take every precaution in that aspect. Don't cut corners, and remember that the symptoms don't always show up. In fact, they show up after you're already contagious. So take all those precautions, making sure that you keep the PPE in place. And then a quick side note on that is one of the physicians that we work with, she said that the most common way people get exposed, even when they're wearing PPE, is when they take the PPE off. And so it's when they use a gloved hand that might be exposed and they reach up to pull off their face mask. It's when they're doffing the PPE that the exposures are actually occurring. So be very careful. Don't let anybody interrupt you when you're taking off the PPE. Make sure it's a very organized process so that you don't auto-expose yourself, as you referred to it. So that's the best practice I can think of.
Yeah, I would echo your comments and reinforce that a lot of the basic exposure reduction practices and processes that we've been certainly trying to push and have take hold just in general for carcinogen reduction and so forth, I think really bleed over into this current crisis as well. There's no reason why we can't be using this almost to our advantage to further reinforce the need for proper decon for, and I get that not every fire department or every emergency services facility has these things available to them, but even to the extent that we're not even wearing our uniforms, our duty uniforms to work, or taking them home with us, that we're washing those articles of clothing in designated washers and dryers at the station. The bottoms of our boots, how are we tracking stuff around? Do we wear our station boots home? All of those little things that really are minimal or no cost at all, I think we can use to our advantage and reinforce as well. So how do you think COVID-19 has, or should I say, do you think COVID-19 has permanently changed the fire industry in terms of training policies, reaction to mental health, et cetera? Is this something that we're going to forget about in a year? Is it going to fade? Or is this something that's going to stick around and help us perhaps in the future to be better at what we do?
I'll start that one. I think it's brought an awareness that there will be mental health consequences to going through difficult things. I love that it's making it okay, more okay, kind of reducing that stigma, which needs to go away anyway. First responders, firefighters, you see so much anyway that you experience that you need to have mental health help for, I think, on an ongoing basis throughout the entire career. Hopefully this will provide some permission for seeking mental health help, because I run a program called the Certified First Responder Counselor Program, and where I train counselors to work with first responders as clients, because I know a lot of, like, the law enforcement officers I work with, particularly, they're not going to go to counseling because they don't go outside the circle. You guys don't trust just any counselor, and not just any counselor gets, the culture and all of the trauma and so forth. So I'm training counselors to get that, to get the different culture and so forth. And I've had this barrage of counselors saying, oh, I want to sign up for this program now because our responders are really going to need counselors now. And my answer to that is they always do. They always have. It's just that the world is kind of becoming aware of it now. I think that's a great thing in that it's providing that permission to go get help now. It's providing more resources. It's going to open up a lot more resources. It kind of annoys me that they're just now seeing it and going, oh, they're seeing some hard things. I want to be like, they always have. But I think it's going to be a positive thing, and hopefully it won't dissipate in a year and it won't just go back to what it's been. I hope that it allows permission to get help and to make it okay or better than okay, or the norm for responders to seek help and to get support and to get, that backing and all of the resources available, and just hopefully those resources will multiply and stay out there.
Yeah.
Well, as a fire chief, I can tell you that we need to seize this opportunity. I think I speak a lot in general about doing a better job of prioritizing responder health and wellness, just in general. And I think we need to do everything we can to lead by example and continue that process. And if we can use these things to our advantage, then we certainly should. I have two more questions that are they're essentially part A and part B linked to each other, and I think that's going to be about it. I think we're going to go ahead and wrap it up after that. How can a person document, or is it possible to document past exposures if they have that information prior to establishing a connection with one of these tracking programs? And also, along the same lines, what if a person has worked for multiple departments? Is there a way of incorporating these features into the tracking?
So I can only speak to First Forward. I'm not sure of the other programs out there, but in First Forward, you can enter past information simply by putting in the different date, different incident number, logging which firefighters are there. So you can always go back. As well, in that program, you can log it for different agencies. It actually selects a drop down, I believe, that you can pick which agency that you had the exposure with, because a lot of firefighters, especially in volunteer agencies, they'll work for multiple agencies at the same time. They might be a professional firefighter in one department, and then they go home and they're a volunteer in their home community. And so they can have exposures with different organizations. And so, as I said, I can only speak to First Forward, but I know it has that element to assist firefighters.
Great. Well, I want to thank the panelists once again for taking the time out of their busy schedules to chat with us today. This has been some tremendous information. You have up on your slide there, ENVISAGE Technologies, our sponsor. Thank them again for the time and the effort that they put into this, as well as the panelists on behalf of the IFC, the Safety, Health, and Survival section, and all of us that are trying to do everything we can to keep our own safe. I really appreciate everybody's participation. And with that, I'll turn it back over to the IFC, and we'll wrap things up. Thank you.
Yes, hi, this is Stephen with the IFC. I was the one running the webinar. I want to thank, again, the panelists, Chief Kerrigan for emceeing, and everybody who is online. If you want any more information, please visit our sponsors and visit us at ifc.org/COVID-19. Thank you guys, be safe, and have a good day.